Today I'm going to be filming a video that I wish I had a few months ago when, if you don't know, I have a newborn baby. His name is Preston and he is 11 weeks old. And when he was first born, he had jaundice and had to be underneath the bilirubin lights. And we made the decision to bottle feed him because it would help speed up the healing process. And it was really difficult for him to go back to breastfeeding afterwards. So I found myself Googling and searching on YouTube best bottle for breastfed babies, and we tried so many. I bought one bottle of every brand, I feel like, and he did not take to any of them, and maybe just like he had maybe two that he liked, but even the ones that he did like, he had a really hard time transitioning back to me, which was really heartbreaking because I of course wanted to nurse my baby. I had a friend tell me to try the Dr. Brown's bottles. She said that they were the best out there, and I decided to give it a go. Which brings me to the star of this video and the sponsor for this video, the Dr. Brown's Options Plus bottle. I love these bottles. Our cupboards are stocked with them. It's the only bottle that we'll ever use. So there's a few key things that I really love about these bottles. The first one is the wide mouth. I think this is really great for going back and forth between breast and bottle because it is more breast-like. Something else I love is that with the options bottles, you can actually use it with or without the vent. And I usually always use it with the vent, but sometimes I forget to put it in and I don't even realize it until I go to clean the bottle that there's not a vent inside, and the bottle still works perfectly fine even without the vent. When you get your bottle, it'll come fully assembled. You'll have a little travel lid and a travel disc to make everything completely spill-proof. You will also get a little pipe cleaner type thing to clean out the vent. The key thing, though, if you have a little baby who you are wanting to fully try and replicate breastfeeding as much as you possibly can, the trick is to get the preemie nipples. Your bottle will come with a size 1 nipple, and if you have an older baby, that's probably perfectly fine. Or if you don't have issues going back and forth between breast and bottle, then you probably won't need to switch. But if that is a worry for you, or you've had experience with your baby having a little bit harder time, if the flow's too fast in a bottle, or if they get lazy at the breast because the bottle's too easy for them, definitely get the preemie nipple because it is the slowest of the slow flow, and I highly recommend it. If you aren't familiar with the Dr. Brown's venting system, when you suck on a bottle without any sort of vent, there is a vacuum that's created, and then when you release the suction, air sucks back in through the nipple, creates bubbles in the milk, and it can make baby fussy and gassy. So a vent option is usually the way to go. With most bottles, the vent is somewhere around the top and you still get air bubbles in the milk. But with the Dr. Brown's, they came up with this technology that pushes the vent all the way to the back of the bottle where the milk isn't, so air never passes through the milk. Something interesting I learned when I was talking to the company about this video is that the impact of air in the milk doesn't just impact the baby with, like, you know, getting air into their stomach and, you know, spitting up and burping and gassiness, but it also has an effect on the vitamins in your milk. Namely, vitamins like A, C, and E are better preserved when they don't come in contact with air. The Dr. Brown's bottles are clinically proven to reduce the symptoms of colic, and in a comprehensive study of almost 1,000 babies, 93% of them accepted the bottle. So I hope you give the Options wide neck bottle a try. They worked phenomenally for us, and I am sure they will work for you too. Another big thank you to Dr. Brown's for sponsoring this video, and I hope you all have a great day, and we'll talk to you later. Bye.